Welcome, everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 173,123 confirmed cases of COVID-19 in Canada and 55,945 cases in Ontario. Chatham-Kent has 371 cases and Sarnia-Lambton has reported 347 cases. Michigan now has 130,842 cases, with 14,615 cases being in Detroit. Today, we are reporting a total of 2,689 cases of COVID-19 since March, an increase of 1 case from yesterday. This case is travel-related outside of North America. 2,576 cases are now resolved and 37 cases are active and being followed by our health unit. 2 people are in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are currently no outbreaks to report at this time. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, diarrhea. Testing is available by appointment at selected pharmacies in Windsor with specific criteria for people without symptoms. Please contact Shoppers Drug Mart Pharmacy for further information. Testing is also available by appointment at the assessment centers in Windsor-Essex. Testing at assessment centers is for those with at least 1 symptom of COVID-19, high-risk contacts as directed by our health unit, and workers or residents of a facility experiencing an outbreak as directed by our health unit. Windsor-Essex has 3 assessment and testing centers: St. Clair College Sportsplex, Windsor Regional Hospital Aulette Campus, and Erie Shores Healthcare in Leamington. And SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must stay home and remain isolated pending your test results. The health unit will call you if you have tested positive for COVID-19. Please note that starting next week, we will be shifting to a new schedule for our YouTube Live updates. After Thanksgiving, we will shift to Monday, Wednesdays, and Fridays. Please continue to visit our website at wechew.org for further information and for our daily counts, which will be updated by 11 a.m. every day. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Dr. Ahmed has joined through teleconference. We'll start with AM 800.
I guess just with the travel-related cases, Dr. Ahmed or Teresa, are you concerned that we're seeing more travel-related cases? Should people maybe stop traveling a little bit here?
Hi, Rob. This is Wajid. I'll start and see what Teresa, if she has anything to add. But basically, yes, that is correct. I think when we moved into stage 3, there were a number of restrictions that were eased, which is to give people more opportunity to do things that they were not doing before when we were in an earlier stage, or when there were a lot of widespread disease activity that was happening everywhere, including there in Essex. We are seeing a similar trend, at least in the other parts of the province, as we are embracing for the second wave. So locally, I think it is important that the travel, international travel, and even local travel to endemic areas such as the GTA area, where we're seeing a lot of cases right now, I would request that people should reconsider that and try to stay closer to home and sticking to some of the recommendations that the Premier has mentioned, including limiting your interaction with just your household family members and and doing it in a way to protect yourself from contracting and also spreading it to others. So I would definitely support people to reconsider those travel plans and try to see if they can postpone it.
When it comes to the border restrictions, obviously they're easing off. I believe it starts today. Any concerns on that end as well? Obviously, people want to see their loved ones, and I think we all agree people should see their loved ones. But do you have any concerns with these border restrictions being eased a bit?
At this point, no. I think we'll have to see what those specific criteria are that is allowed based on what I've heard in the media and from the minister. It seems like there are a very specific group of people that closed family members are only allowed, and they still have to do the 14 days quarantine. So I think that's understandable from a compassionate ground perspective, and I'm not entirely concerned about that. But if it includes other type of travelers, I think then that would pose more risk for our community. But for close family members, and especially for a reason, I think following the quarantine law, it would be reasonable balance to understand the human side of the things.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Just wondering if you've heard anything about the distribution of flu vaccines in the region. Is it going well? Is there a delay? Are the pharmacies, physician's offices not able to get them yet?
So I can answer that. We have received our shipment of vaccine, which will go to high priority groups. So long-term care homes and hospitals will be the first priority group. And then after Thanksgiving, typically the vaccine will be distributed to everyone else for the public. I do know that the pharmacies are getting direct distribution. It doesn't get distributed through our health unit, so they will get it directly from the Ontario government pharmacy, and pharmacies do have their vaccine. But right now we're on target with what we usually get every year.
Thank you.
Any questions from Blackburn?
Not today, thank you.
Any questions from CBC?
Not right now, thank you.
Okay. Any further questions from AMA 100?
No, I'm good, thank you.
Windsor Star?
No, thank you.
Blackburn?
No, thanks.
CBC?
No, thank you.
Okay. Thank you, everyone.